Welcome to this video on the anatomy of the stomach, presented by Medicos Online. We will cover its structure, position, and surfaces. The stomach is the most dilated part of the gastrointestinal tract, or GIT. It occupies the epigastric, umbilical, and left hypochondral areas, located in a recess bounded by upper abdominal viscera, the anterior abdominal wall, and the diaphragm. The main parts of the stomach include the fundus, body, antrum, pylorus, and the incisura angularis. The stomach varies in position and contour, which can be categorized as hypertonic, orthotonic, hypotonic, and atonic stomach types, showing different shapes and locations within the abdomen. At rest, the stomach is roughly J-shaped. Its size and shape change depending on the volume of food or fluid, body position, and phase of respiration. It tends to be high and transverse in obese persons and elongated in thin persons. The mean capacity of the stomach is approximately 30 milliliters at birth, 1,000 milliliters at puberty, and 1,500 milliliters in adults. The stomach has 2 openings, 2 surfaces, and 2 borders. Let's look at the gastric orifices, starting with the cardiac orifice. It is situated to the left of the midline behind the 7th costal cartilage, about 2.5 centimeters from its sternal junction at the level of T11. It's about 10 centimeters from the anterior abdominal wall and 40 centimeters from the incisor teeth. The pyloric orifice can be identified by the prepyloric vein crossing its anterior surface vertically. It is located 1.2 centimeters to the right of the midline in the transpyloric plane when the body is supine and the stomach is empty. Examining the gastric curvatures, the lesser curvature extends between the cardiac and pyloric orifices, forming the right border. The incisura angularis is a notch in the most dependent part, whose position varies with gastric distension. It provides attachment to the lesser omentum. The greater curvature is 4 to 5 times longer than the lesser curvature, starting at the cardiac incisure. It arches upwards and posterolaterally to the left, with its highest convexity at the fundus, located at the left 5th intercostal space. It finally turns right to end at the pylorus. It attaches to the gastrosplenic ligament to the left of the fundus and to the greater omentum beyond that. The stomach has 2 main surfaces, anterosuperior and postero-inferior. The anterosuperior surface's left part is posterior to the left costal margin and contacts the diaphragm. It is related to the costal attachments of the upper fibers of the transversus abdominis, separating it from the 7th to 9th costal margin. The upper and left parts of the anterosuperior surface become posterolateral and contact the spleen's gastric surface. The right half is related to the left and quadrate lobes of the liver and the anterior abdominal wall. The entire surface is covered by peritoneum, with part of the greater sac separating it from the structures above. This illustration shows the relation of the stomach to surrounding organs and vasculature. The postero-inferior surface is related to the stomach bed, which includes the diaphragm, left suprarenal gland, the upper front part of the left kidney, the splenic artery, the anterior pancreatic surface, and the colic flexure, along with the transverse mesocolon. The interior of the stomach comprises a large, globular left part and a narrow, tubular right part. Let's examine the gastric microstructure, which includes the mucosa, submucosa, muscularis externa, and serosa. The mucosa is thick, smooth, velvety, and reddish-brown to pink in color. In a contracted state, the mucosa folds to form rugae, which are longitudinal and more marked towards the pyloric and greater curvature. These are large folds in the submucosal connective tissue and are obliterated when the stomach is distended. The mucosa consists of 3 layers: epithelium, lamina propria, and muscularis mucosa. The epithelium appears honeycombed due to small gastric pits, called foveolae. The base of these pits receives gastric glands that extend deep into the lamina propria. The epithelium is composed of simple, columnar mucous cells. Gastric glands are divided into 3 types: cardiac, principal, and pyloric. Cardiac glands are situated near the cardia. Principal glands are found in the body and fundus. Pyloric glands contain numerous mucus and enteroendocrine cells. Principal glands are highly differentiated and located in the body and fundus, composed of different cell types. These cells undergo constant replacement every 3 to 7 days and include chief, parietal, mucus, stem, and enteroendocrine cells. This image illustrates the cellular structure within a gastric gland. Cardiac glands are situated near the cardia, primarily featuring mucus-secreting cells. Pyloric glands, in turn, are characterized by the predominance of numerous mucus and enteroendocrine cells. The muscularis mucosa is made up of an inner circular layer, an outer longitudinal layer, and an external circular layer in some places. The submucosa consists of loose connective tissue, collagen, elastin, and the submucosal plexus of the stomach. The muscularis externa has 3 layers: oblique fibers, circular fibers, and longitudinal fibers. Oblique fibers are limited to the gastric body and are most developed near the cardiac orifice. Circular fibers form a uniform layer external to the oblique fibers and create the annular pyloric sphincter at the pylorus. Longitudinal fibers are arranged in 2 groups. The upper region of the stomach acts as a storage area, while the lower region has a pump-like action for mixing and delivering contents to the duodenum. Gastric vessels include the left gastric artery, right gastric artery, left and right gastroepiploic artery, and short gastric artery. These arteries anastomose in all layers, forming subserosal, intramuscular, and submucosal plexuses. Mucosal arteries usually arise from the submucosal plexus. However, along the curvatures, they arise directly from subserosal arteries, making them vulnerable to ischemic injury. Arterioles from the submucosal arterial plexus penetrate the mucosa, forming capillary beds that drain to the submucosal venous plexus. This rich blood flow carries bicarbonate to protect cells from acid damage, a process facilitated by fenestrated capillaries. The stomach is supplied by the gastric nerves, which are composed of parasympathetic and sympathetic fibers. The parasympathetic fibers come from the vagus nerve. The anterior nerve from the left vagus divides into gastric and pyloric branches. The gastric branch radiates across the anterior surface of the body and fundus, including the greater anterior gastric nerve or anterior nerve of Latarjet. The pyloric branch typically consists of 2 nerves. One traverses the lesser omentum, while the other arises from the greater anterior gastric nerve and passes obliquely to the pylorus. This illustration provides a visual reference of the anterior nerve distribution. The posterior nerve, from the right vagus, divides into gastric and coeliac branches. The gastric branch radiates over the posterior surface up to the pyloric antrum, including the greater posterior gastric nerve. The coeliac branch passes to the coeliac plexus. Sympathetic supply comes from the coeliac plexus, hepatic plexus, and left phrenic plexus. Inconstant branches originate from the left thoracic nerve, thoracic, and lumbar trunks. These nerves form the submucosal plexus of Meissner and the myenteric plexus of Auerbach's. Gastric lymphatics are continuous with those of the esophagus and duodenum, arranged in 4 main groups. The first group accompanies the left gastric artery, draining a large area into the left gastric nodes. The second group accompanies short gastric and left gastroepiploic arteries, draining to the pancreaticosplenic node. The third group drains the right half of the greater curvature, ending in right gastroepiploic nodes, which drain to pyloric nodes. The fourth group drains the pylorus to hepatic, pyloric, and left gastric node. This illustration shows the lymph node distribution along the anterior surface of the stomach. Here is the distribution of lymph nodes on the posterior surface of the stomach. Although the lymphatic vessels communicate, the valves direct lymph flow. From the right part of the stomach, lymph flows toward the lesser curvature, and from the left side, it flows toward the greater curvature. Thank you for watching this video on the anatomy of the stomach.